Hi, my name is Leanne Jalan. I'm the Director of San Juan Basin Public Health. We're the local public health for Archuleta and La Plata counties here in Southwest Colorado. We're here today to give some updates about the state of COVID-19 across the state of Colorado and then how that's affecting us locally. So unfortunately, in Colorado, we are seeing a very dramatic rise in cases across the state. Cases continue to increase exponentially. We have not flattened that curve over the last month. Our week-to-week increases continue to exceed the modeling from the prior week. So it means that we look at the data across the state one week, we predict what we expect to see the following week, and we immediately blow past that prediction and see more cases than were expected. Our hospitalizations in Colorado right now are at the highest point of this COVID event, meaning that we have more people in the hospital in November 2020 than we ever had in the hospital in March or April. With this tremendous increase in cases across the state, we are seeing many jurisdictions not be able to keep up with testing, not be able to keep up with contact tracing, and not be able to keep up with supporting people through quarantine and isolation. With these systems all overwhelmed because the cases are increasing faster than the models show and faster than we expect, we are taking steps across the state to bring down the level of disease and the level of infection through mitigation. So with all of these systems that we use to contain disease currently overwhelmed across the state, we are on a path to exceed our ICU capacity across the state of Colorado by December. So with that, communities across Colorado are making really tough decisions to try the best we can to contain the disease that we have now and help us not exceed our healthcare capacity and try really hard to get things back to normal with a manageable amount of infection in the community. The types of interventions we need now are different than they were a month ago. That is the only thing that we can do is come together as a community to work together to decrease the amount of infection that is being spread in our community right now so that we can avoid future stay-at-home orders or future drastic measures. This is a short window of time that we have as a community to do the very best we can to change this path. Here locally, we've seen about 250 cases in La Plata County over the last 2 weeks. This is more cases than we saw in the first 6 months of this pandemic. So of course, some of that is due to more tools and more testing to uncover more cases, but the hospital transmissions across the state tell us a very different story. This is not related to testing only. This is infection spreading across the state of Colorado. With that, La Plata County is changing its level of restrictions on the state safer at home dial to level orange. This means that we are joining over 20 counties across the state who have had to move to level orange because of increased cases. This acknowledges that we have become a high-risk community and that we can continue to take steps to lower transmission in our community. The specifics about what level orange mean can be found on our website, and we'll make sure to have that link put into the chat with this video. The really important thing about level orange is that it asks community members and businesses to limit capacity of places where we congregate to 25% rather than 50%. The details are available on our website. They're available at the State of Colorado website. We will make sure to have all of the details in the chat and available for you to go to that link and learn about it. But really what it's asking you to do is lower the indoor capacity so that we are less likely to be in close contact inside. What we know about COVID is you're 20 times more likely to catch it inside than outside. So level orange really asks that people are very careful about how we spend time together inside. The other thing that we're doing is we're putting in a public health advisory that asks people to limit their activities after 10 p.m. every night. So with level orange, restaurants do close at 10 p.m. now, and we're asking everybody to do that, right? We don't need to be doing non-essential things after 10 p.m. And it's best not to be in social gatherings after 10 p.m. because that is where we see a lot of spread. In fact, where we're seeing spread in this community right now is in our private social gatherings. This makes sense. We miss each other. We want to spend time together. Of course, that's what we want to do. We just have to really do it more safely now than we had to do it even in August, September, and October, because there's simply more infection in the community. So if you're less safe now, you're more likely to come in contact with someone, even in your small social setting that is currently infectious with COVID-19. One of the things that Colorado has published recently is that there are communities in Colorado where right now today, 1 out of 50 Coloradans is currently infectious. What we're seeing here locally is probably closer to 1 out of 100, but still that's a startlingly high number. So it means that we have to conduct our business differently. And speaking of businesses, the other thing that's important is thinking about our workplaces differently right now. We see a lot of spread in workplaces, and that's because we spend lots of time with people we work with. So we're asking people, if you have a business or a type of job that you can do from home, please do it from home. All governments in the state of Colorado have been ordered to send as much of their workforce home as possible. So we're all doing that. We're hoping that all private businesses can follow suit when it's appropriate. If you cannot work from home, then this is a time to really kind of look at your procedures in your workplace and think carefully about how can we get better at stopping or slowing spread within our workplace. If we can really change our social gatherings and our workplace spread, we have the opportunity to lessen the amount of infection in our community right now. So we have received some questions from the last time that we did this. So we're going to take some of those questions now. And please remember that we're always open to receiving questions and doing the best we can to answer them here on these video chats. So one of the questions we have is why 10 p.m. and why focusing on one household? So it is true that COVID-19 does not spread more easily after 10 p.m. What we're seeing in our case investigations is we do spread a lot of infection in private social gatherings, and private social gatherings that go late into the night where there is alcohol consumption is a really good recipe for spreading infection. For at least the next couple of weeks, if we can limit our social interactions to members of our own household, that's going to really help us cut down on infection in the community. So again, the 10 o'clock recommendation is a recommendation based in this idea that we should be home, and we should be home with our own family members. We're seeing cases rise here in La Plata County, and like we said, we've had about 250 positive cases over the last 2 weeks, which is a very high number for us. There is a question about, is this related to the amount of testing we're doing? And in fact, it's probably the opposite. As we are finding positive cases, we recommend anyone who's been exposed or anyone who is symptomatic to also go in for a test. So the first thing I want to say about that is, if you've been exposed, don't go for your test too early. If you've been told in a case investigation that you've been exposed, we ask that you not go for your test till at least day 5. And actually the 7th day is the best day to get in for your test. A lot of times before day 5, you're really likely to get a false negative because viral load hasn't built up enough in your body for your test to be positive. And then what's unfortunate is some people think, oh, okay, I got a negative test, I don't have to quarantine anymore. And then they get sick a couple of days later. So that's an important step, is if you've been exposed, go in for a test. So one of the things that we're really proud of in this community is that people are taking that recommendation to heart. So what we're seeing is more people using testing because they've been identified in a case investigation as needing a follow-up test. In fact, over 80% of our case investigations are people who are currently symptomatic when our case investigators reach them. So our growth in testing and our growth in numbers are related here locally. The problem with this is that we've exceeded the capacity for testing that we had built over the last couple of months. We do have a free community testing site. It is available to everyone. This is not the case all across the state of Colorado. So we're really proud to be able to offer this to the community, and we're really proud of community members for showing up to get tested at this site. We now found out this week that with this very steep increase, we're going to have to do more to make sure community testing is available. So we asked La Plata County to activate the Emergency Operations Center so we could have a whole of government assistance in making sure we have enough testing, because testing is step one to containing disease in any community. So with that, La Plata County has offered a tremendous amount of resources. The city of Durango has, Animas Surgical Hospital has offered more staff. We had existing partners at this community site prior to this ask to increase it. And immediately we've been able to extend hours and start working on adding more locations. So there will be more information to come on that. And we're very sorry that people have had to wait in line a long time for testing. The entire country is surging in cases, and anybody who has been exposed or is symptomatic is recommended to go in for a test. And like we've said, our community has been really great about doing that follow-up. It is really unfortunate that when our community members take the right steps and do that follow-up, and then there's too long of a delay to get the result because there is so much pressure on the system. So the state lab in Colorado built capacity for the last 6 months to be able to handle the amount of testing that we need to get out in the community. The state lab got up to 8,000 tests a day and then quickly started receiving over 20,000 samples a day. So with that, we worked with our state partners. We have been able to contract with a different lab, but still counted as community testing paid for by the state of Colorado. So our tests go to a different lab, which are faster than the state lab. It usually is 1 day of shipping and then 48 hours to turn around in the state lab to get you a result. One of the things we find is that if people fill out their paperwork in a way that their email is not entered properly, they don't get a result from this lab in California for a negative test. Obviously, anyone with a positive test gets a result from our staff to launch a case investigation, but we have to ask people to be really careful when you write down your email address for your negative result. And we are working on automating that system so that there isn't a human error of somebody entering an email wrong. And as soon as we get that fixed, we expect that people will get their results faster. We need to thank all of our community partners who have helped us get community testing available in this community. And the other thing I really want to do is thank the San Juan Basin Public Health staff that has been working through this test site, has now increased the hours that we are spending at the test site, and especially the case investigation staff. After we get positive results back from all of the testing we're doing in this community, this team has been working round the clock to contact trace, to let people know that they've been exposed, walk them through what their next steps are, and offer people resources to quarantine and isolate. Again, this is a whole of community effort, and we could not be doing this without the help and support of other government agencies, other healthcare partners, and especially each and every member of this community who is taking this seriously, practicing social distancing, wearing a face covering, and trying hard to limit spread of infection in our community. Thank you to each and every one.